Good afternoon. Hello. Good evening. Thank you all for coming. My name is Geraldine Stafford. I'm the Manager, Equity, Diversity, and Inclusion with Waterloo Regional Police, and I'm your MC tonight and your question and answer moderator. In my role at WRPS, community engagement is key so that we can make community-informed decisions. We're really excited to have you here today. Thank you for joining us, and we're here today to learn more about our hospital merger and redevelopment projects. Over the coming months, we will be holding more events like this with our communities, and we will provide more opportunities for you to receive more information about the projects, ask questions, and get involved. Your input will help shape the future of healthcare for Waterloo Region and beyond as we progress in the planning of these major hospital construction projects. Before we begin tonight, we would like to share a land acknowledgement.
Thank you, Geraldine, and good evening, everybody. My name is Sarah Farwell, and I'm the Integrated Chief Communications Officer for both Grand River Hospital and St. Mary's General Hospital. June, as you all know, is National Indigenous History Month, and I'm grateful to be able to bring you the land acknowledgement tonight, which was created by the Indigenous Employee Circle at Grand River Hospital. Grand River Hospital and St. Mary's General Hospital acknowledge that the land on which we live and work today is located on the Haldimand Tract of 1784, a formally ratified agreement acknowledging 6 miles on either side of the Grand River as treaty territory belonging to 6 nations of the Grand River, and is within the territory of the Haudenosaunee, Anishinaabe, and Chinantan people, the same lands on which we are meeting tonight here at the Kitchener Public Library. In this territory, Indigenous peoples continue to endure inequity, violence, and oppression due to colonialism. This is magnified by the historical and ongoing widespread failure by settlers and institutions to uphold their responsibilities within the dish with one spoon wampum. Grand River Hospital and St. Mary's General Hospital acknowledge the enduring presence and deep traditional knowledge, laws, and philosophies of the Indigenous peoples with whom we share this land today, their achievements and their contributions to our community. We are committed to understanding the impact of settler colonialism on the Indigenous experience in order to co-create collaborative, respectful paths forward together in mutuality and reciprocity. We were very grateful at our last town hall in January to have Elder Mayengan Henry of Cree origin here with us. And Elder Henry offered at that time a traditional teaching. And we are so grateful for these teachings and this education as we really move towards truth and reconciliation. We're also grateful for the partnership we have with many Indigenous community members. I'll turn it at this point back over to Geraldine.
Thank you, Sarah, for helping us take a moment to reflect on our history and legacy with respect to the lands we're on and our relationship with Indigenous populations, past and present. It's even more impactful as we're gathering today to get together. Today, this month, is also National Indigenous History Month, and today we come together with open hearts and open minds in collaboration of unity. Tonight, we're hoping to achieve 3 things. First, we want to share with you more of the reasons behind the board's decision to voluntarily merge Grand River Hospital and St. Mary's General Hospital. Second, we want to answer some of your questions. And third, we really want to hear from you. When you came in tonight, you would have seen some discussion boards, which we encourage you to add your thoughts to. Also, if you haven't done so, we hope that you'll take the time to complete our recently launched community survey. It will open until August 31st, and your insights of the survey will help our hospital teams as we continue in the merger work. So enough of the communications, and our integrated communications team was put together, like I said, the discussion board and the community survey. So right now, I'd like to introduce you to your speakers for tonight. I think it's humid or something, that's why I'm it's hot. All right. As leaders of our local healthcare system, our panelists, along with the staff, physicians, and board members of Grand River and St. Mary's, are committed to work side by side to make this project a reality for the communities of Waterloo-Wellington and beyond. Leading the conversation and here to answer your questions are Ron Gagnon, President and CEO, Grand River Hospital. Mark Pham, President of St. Mary's General Hospital. Tim Rollins, Board Chair, St. Mary's General Hospital. Sandra Hammer, Board Chair, Grand River Hospital. And Cliff Harvey, Joint Vice President, Redevelopment at Grand River Hospital and St. Mary's General Hospital. Let's have a round of applause. At this point, I'm going to invite both Tim and Sandra to the stage and hand the evening over to them.
Thanks very much, Geraldine. Grand River and St. Mary's have had a very long history of sharing resources and services in order to best meet community needs. Some examples of this include nuclear medicine, lab services, pharmacy, digital health, and jointly credentialing our more than 700 medical professionals. We thought we'd start the evening with a little bit of a journey, and this map looks, believe it or not, small, but it is fairly comprehensive in what we've been doing together in terms of this particular plan. We started in 2020 and 2021 planning and looking at consultation of what our new and revitalized structure should be. Moving forward to 2022, we received a Ministry of Health grant to do our capital planning project. In 2023, consultations and engagements continued and the site selection process began. In April 2024, St. Mary's and Grand River boards decided to merge and begin the due diligence approach to what we need to be doing. What we're planning for the summer of 2024 is to engage, and you've heard a little bit about it tonight, all of you in our planning on what the new hospital needs to look like. In the fall of 2024, we will be submitting, our plan to submit the final report of where we are headed to the Ministry of Health for approval with the merger. And we are still targeting for April 2025 to be a new single entity providing health services in our community. Post April 2025, it will still take us a little bit more to continue to flesh out the merger and also to move forward with the work that's ahead of us. Went too fast. The map is a lot, and we want to go faster than what we have been doing. But we are building on a 40-year history of working together as two organizations. We also took a look at what we can't have the conversation today without looking at what is needed in our community. We know that we have overcrowded emergency departments, our wait times are higher than we would like them to be, and what the community deserves. We have a rapid community growth projected. You've heard many people say that we're going to be over 1 million in population very, very soon. I think that number, Tim, keeps moving from, is it 2020, is it 2030, or is it tomorrow almost? But we do need to be planning for that million. So what does that look like? We have competition for top healthcare professionals. If we're able to have state-of-the-art facilities going forward, which this community deserves, we believe that it will help us attract and retain the top-notch professionals in our community. Our facilities are old. Many of you in the audience have been in our facilities and know that we need to do some upgrading and revamping. We also want to leverage the innovation and be further ahead with new and more efficient ways to care for patients in our hospital and also in the community at large. So 2 projects. We've talked about building the future of care together, which is our redevelopment project, and that will continue on. A little bit later, Cliff will talk a little bit more about where we are at. Tim and I are here to share with you the merger and the joining of our 2 organizations together. So you need to be thinking about the 2 projects as we go forward. And we believe by having the 2 projects together, it will build a stronger community and stronger healthcare services for us. It will allow us to have new and innovative approaches to care. We'll have modern, state-of-the-art care facilities. We'll have improved access to fully integrated, high-quality, and efficient care. Much better experiences for patients, because we're going to listen to you also on what you want to see from your experience. Better experience for our team members, having better spaces to work with and having the resources to care for you the way that they want to. Ready to meet the needs of our growing community. Not only is the population growing in number, it's also growing in diversity and different needs that our population needs. So how do we make sure that we are able to serve our population in the best way that we can. And we truly believe that we are stronger together.
Thank you, Sandra, and welcome everybody. I'm energized to be here, a bit hot, but energized. As Geraldine shared with me at the start of tonight's town halls, the hospitals together have launched a community survey just last week. And this survey is really a method to better understand what our hospital teams and the communities we serve believe is important. And so one of the things we've heard from the initial responses, and this was, I think this was apropos, is thank you for putting our communities first. And I think this really sums up the thoughts of both boards at Grand River and St. Mary's. And everything we've been doing today, it's been about community, about what our community deserves, about what our community needs, and about looking forward and how our community is changing and how we need to change to ensure that we're servicing the community appropriately. And so everything that we've talked about on our journey today and we'll continue to focus on tomorrow, community is at the center of that journey. It's what the individuals and people of Waterloo region, Wellington, and far deserve. So what are we hearing from our initial conversations? And I am sure we'll have much more over the summer, but what are we hearing today? First, patients first. So everything we need to do needs to focus on the patient and on our community. Compassionate care. When we have families and patients in our hospitals, they're going through a tough time. They're going often through a traumatic time. And so compassionate care is going to be a pillar in everything we do. It's a pillar of what we do today, and it will be a pillar of what we do tomorrow. And we need to expand our excellence in quality. Again, those are standards that we abide by today. But with the tools, with coming together, we hope to strengthen our excellence and our quality and be able to bring more talent to this region to focus on our community. So what does this mean for hospital services today? What I can tell you is, well, we have the redevelopment project that's underway. And while we've announced that we are going to attempt to merge by April 2025, there will be no effective change in service today as you're used to. The 3 sites will continue to operate as they have been. St. Mary's will continue to operate as it has been. And over time, as we look out on the journey to the redevelopment, et cetera, there may be tweaks. But the reality is we have 3 sites, 3 aging sites that we're going to have to operate out of until we get some shovels in the ground in our new hospital built. And so for the time being and for the next little while, we don't expect there to be any significant changes in how we operate. Having said that, by coming together, by leveraging the partnership that we've had for the last 20, 30, 40 years, we believe we can learn from each other, continue to develop each other, learn practices that each hospital might be doing uniquely or differently that are best practice, and collaborate over time and bring those best practices to our community and to yourselves. So be patient, this will take some time, but we do believe that for our community, it's better to come together in the long term. Okay, so what's next? Well, this has been a journey, as Sandra went through earlier. We're in the middle of it. There's still a lot to come. So, first off, we need to complete due diligence, both financial due diligence and legal due diligence. And what is due diligence? Why do we need to do it? Anytime 2 hospitals want to come together, ultimately the ministry needs to approve that merger. And we need to develop a business case to submit to the ministry. And as part of that business case, it's going to be important that we've completed the financial and legal due diligence to understand that there's no significant hurdles or obstacles that we would have to overcome from a merger perspective. That due diligence is underway, it's almost completed, and the boards will be presented that with material in the coming weeks. At that time, we'll make decisions. This one, the next one is a community and team engagement on the merger. So that formal process started earlier, or late last week, but really it's been ongoing for a number of weeks and months today. And there'll be a lot more of it over the summer. Our teams plan on being at a number of festivals during the summer, out there, seeking input, seeking engagement from all of you. And tonight is another journey and another way where we can get your input. This hospital, this merger, the future of healthcare in our region is for you, and we want your input. Okay. The site announcement. What everybody wants to hear, what everybody wants to know. Where is this new shiny building going to go? I have no news to share with you. My lips will remain sealed. Today, we're making good progress. And earlier than anticipated. A new name and a visual identity. This is another hot topic for our community. And this is one where we'll be really focused on getting community engagement. From yourselves, from our frontline staff, clinicians, or volunteers, or nurses, everybody will have input into what this community and what this new hospital and new integrated team is going to be. That process, again, will start in the summer or go into the early fall. Stay tuned. We're really excited. This is the one thing we are really excited about, how we frame the name and the image of our new hospital going forward. Functional design planning. Oh, there's a lot of work to do on this one, right, Cliff?
Correct.
This is where we get really into the details and the weeds. And that work has started, but there's a lot more work to come. And Cliff and team and the internal teams are going to be working on this. And again, we'll be using your input to help shape what that design planning is going to be. Again, we want your input. Ongoing redevelopment and coping work. So that will continue in the same way. It's a big project. This takes years to do. Cliff is behind the scenes working on it, but stay tuned. Again, your input will help shape what that redevelopment and coping work will look like. And then lastly, the future of the St. Mary's site. What will happen with that future? As I said, the St. Mary's site will be operational as it is today for the next 10 to 15 years while we're putting this plan in place. But the system, the St. Joe's healthcare system, with the Board of St. Mary's, is actively now starting a process to seek input on what the future of that site could look like. There are a tremendous amount of community health needs that this region faces today. And let's be honest, with the population growth that Sandra mentioned, and with how our community is rapidly diversifying, there will be endless opportunities for keeping individuals, providing the health system, but keeping individuals out of the acute care system and providing them the supports they need. And so, together with St. Joe's, we'll be doing a separate project on the future of the St. Mary's site and what that could mean. There will be community consultation with that, and so stay tuned. That process will be starting this fall as well. All right. So enough of my talking. I want to turn it over to the star of the show, Cliff Harvey. Cliff is going to give everybody a redevelopment update. Thank you.
Great. Thank you, Tim and Sandra. And thank you, everyone, for the opportunity to speak to you. Again, as we mentioned in January, we want to give constant updates on what's happening with the new hospital development, as well as the other developments on the site. You probably recognize this map. It looks very similar to Sandra's map in terms of time, which is a really important concept, that the two hospitals continue to work together and plan together. This is significant because with my experience over the past 20 years, often this doesn't occur. And the fact is that we talk about the new hospital, it's a lot of bricks and mortar, it's a new site, but it's really what's so important about a new hospital is not the bricks and mortar, but what the services are inside it and how the patients and staff experience encourage high quality healthcare. And the fact is that these two journeys are happening side by side, means that this hospital has a great opportunity to be a leader in the development of hospital design in Ontario, and I would argue around the world. As you can see, I'll just point out two main milestones. back in May of 2022 when we first got our planning grant and the Building the Future of Care Together kicked off as a building project, Building Together. We made great progress to the point now in discussions with the Ministry of Health that we've answered all their questions, and we're excited to be ready to go to stage 1.3, which is functional programming, as Tim pointed out, which is an incredible amount of work as we plan out the services in the new hospital, as well as with the existing hospitals as well. And then when I joined back in the winter of 2024, or 23, sorry, you've already started an extensive process to find that site, which will remain nameless until later. But I will say, with the community engagement and the number of inputs that we had around the criteria, over 1,000 different inputs, I have to say, again, over my experience, this was one of the best run site selection processes. It was open, fair, and transparent, and it had an amazing amount of engagement. We're excited to make that announcement very soon. But what's next for us? We're going into this summer, we're starting our design, vision, and principles engagement, looking at what are we going to do to inform the design of the facility. And again, I'll repeat that a lot of that's coming out of the way you want to provide care, how we want to provide care, what your experiences are going to be in the new facility. And then in functional programming starting in the fall, just for those who may not understand the functional programming aspect of it, this is when we actually look at the programs inside the hospital, how they're integrated, how they're associated, and then what the patient experience will be, and what the staff experience will be, because those will be the focus. I will note that similar to the engagements that will happen throughout this summer, we'll be also looking for engagement. We'll have pop-ups. And if you go to the BFCT website, Building Together, we'll be broadcasting where some of those events are happening at both the community fairs as well as with local markets. Again, seeking your engagement and input. And the last one I just wanted to bring up is we still have a long way to go. A lot of people talk about why does it take 10 years to build a hospital? Well, I can say 6 of it is spent in construction. We have no chance to change that. That's the nature of building such a large facility, such a complicated, I would even argue, complex facility providing the care. If you go back 3 years, that only gives us time to actually put the RFPs together, put the contract documents, do the tendering, find the contractor. So that's 9 years out of the process. This one last year that we've been working on is really around planning. But I would say it's the most important part. If we don't get this input right, if we don't plan our services right, that next 3 to 10 years is going to be about building a hospital. But it will be the right hospital. I can tell you it will be the right hospital with your engagement and with your participation. Ahead for your engagement, and I look forward to designing the future of healthcare for the region. And on that note, I think do I pass it back to our MC or?
Here I am.
I missed the rehearsal, so this is where.
That's okay. Wow. Well, if they're looking for land, I have it back here. Not quite big enough, but. All right. Thank you very much. So right now we're going to do a little bit of housekeeping and we'll bring up our panelists. As we're doing so, if you have questions, please get them ready because we'll be coming to you. You know, it's so wonderful to have, such openness to conversation, transparency of where we are in the process, and to have the leaders here, take their time to come tonight and, share with you. So I'm, as a resident of Kitchener-Waterloo, very, very honored to be part of this discussion tonight. Okay. So we will start with questions. Does anybody have any burning questions that, we want to start with? All right.
Could you turn it off and just pull it out?
Well, what I'm kind of hearing here is that this new general hospital is going to be replacing the two existing hospitals that we have now. At least that's what I'm kind of hearing from your presentation. So if that's the case, what are you going to be doing with Grand River and St. Mary's in the future?
Thank you for that question. I'll start, and I'll pass it on a little bit, but we are adding one new acute care site to a campus that's going to have actually 3 facilities. So the current KW site, the current Freeport site will be part of the new acute care facility altogether. So think of it as 3 locations. And as Tim mentioned earlier, the current St. Mary's site needs to continue to operate until we have the new build done. So we still will have 3 facilities like we currently do, but one very brand new acute site.
I think you covered it well, Sandra. We're going to come back out to the community in the fall about the future of the St. Mary's site. We know it's in a prime space. It's a great opportunity for health and social services that are our broader community needs. So we're really excited to start talking about that future site as well. So we still see the site involved in healthcare in our community, but how it looks will be a question that we work through in the fall.
We had a question online, and this question, again, goes down to the fundamentals. And the question is, what is due diligence, right? So it's an interesting legal term, from my background, but that really, I think, forms all what's going on. And I'm gonna have Tim answer the question of what due diligence is.
Sure, and I referenced this in my earlier notes. So there's both financial and legal due diligence, and effectively what it is, it's a ministry-driven process, but it's also to allow both organizations the opportunity to make sure that as we're coming together, there are no significant material. I'm an accountant, so I use material a lot. Material issues that would prevent a merger or would cause pause, and we'd have to look at other ways and other what's the word I'm looking for? But other means to try to address those issues. As we headed into this process, because again we've been working so closely together for a number of years and throughout this process, we've been very transparent with each other, and we don't expect there to be anything significant. But again, you really have to do it from a ministry perspective. They demand it, they want to see it, and we want to make sure that as they're supporting this, there's no skeletons in the closet, so to speak, that need to be addressed.
Thank you. Yeah, when I hear about the due diligence, I think about my past as a runner, and I was a sprinter. But this journey, right, it's not a sprint, right? We have to do the work up front. We have to be intentional about what we're doing. So thank you for that.
Hi, I'm concerned about the finances. Where's the money going to be coming, and which levels of government are going to be providing the funds for this new hospital?
I think we have an accountant.
I love it. The easy question comes to me. And I think your question is in 2 components. There's the cost with merging the hospitals and how they operate, and then there's the new hospital. And
I'm more interested in the cost of this new hospital.
of the new hospital. Right, so as is typical in Ontario, that is a partnership between the province of Ontario, which typically funds 90% of the cost of the hospital being built itself. And the local community, which is a combination of fundraising in different ways, and that covers the cost of the new equipment and 10% of the hospital costs. So that is the approach that we will be taking. You can expect that that will be a multi-year approach. And we know that through our foundations, we're well set up to be quite successful. And we also know from the feedback we've received already in the community that this is a community that really wants to see this happen. So we're looking forward to that journey, and it will be that. And that is the typical way of approaching funding for new hospitals in the province.
So I was here at the last meeting and somebody said that there was 50 communities that needed new hospitals. And it was whoever was gonna have the best proposal that would get the money.
And I think that continues to be true. And the merger of the two organizations actually helps to put us in even better stead than we already were with the Ministry of Health. I think having the expertise of somebody like CLIP has helped our community to also leapfrog other communities that might be vying for the same type of support from the provincial government. And I know that the continued push and the continued support from our community at large will also play a big role in helping this region, this community, get the healthcare facilities that it needs and deserves yesterday.
We currently don't have it, so why do we expect it in the future?
I'm sorry, we currently don't have adequate medical care, so why are we thinking optimistically it's gonna happen in the future?
I think that's part of our work. Our work is to be able to advocate for our community, to demonstrate the need, and to have that conversation with the province. But it's also for all of us as a community to advocate together for this. We've got really positive support from the province so far. We hope that'll continue. But it is also the work we need to do as we think about coming together. The merger is absolutely important in terms of where we think how we deliver better hospital care for our community together. We think we're much stronger together. It's also important as we do have those conversations with the ministry to say this community is ready to take the next step. This community is ready to take the next step in terms of the new hospital. This community is ready to take the next step in bringing healthcare together. The province is looking for communities who are ready for that next step, and it is a way to push us ahead.
And great questions. It's really important that we do have these tough conversations and have these tough questions answered. Part of that due diligence that we're talking about, right? It's important that, we come together, the community, ask the questions we need to ask, and, be comfortable together with the decisions moving forward. All right, we have another question?
As you advocate for a new hospital, will you also be advocating and planning for services that currently are not provided?
That's a great question from a former planner. I think I'm seeing in the audience. So thank you for that. As Tim and I spoke before, one of the key things as we were talking about the plan, and initially we were thinking we could do this separately, operating the two facilities. We quickly realized that coming together and merging, the question became, why not now? And really wanting to build on the programs that we're able to offer now, and then provide that space for us to attract and retain new programs and services. So that'll be a key part of what Cliff was talking about in terms of our functional planning. What is it that we need to have? And I'm not going to go through that. I'll let you answer that.
I'll maybe start quickly and turn it over to Ron, because I think it's really great work that Grandma's been leading in this. We're always looking at what the new services are that our community needs. If I think about even in the last year, we launched new retina trauma services at St. Mary's, so people aren't going to Hamilton, to London for those eye traumas, they're able to get the care here. But we're looking much grander than that as we think about joint advocacy for new programs for our services. Ron, do you want to talk about the future of neurosurgery?
Sure. So there's been work happening for the last couple of years around building the case for, I don't want to say bringing neurosurgery to the region, but bringing it back, because it used to be here. We used to have a neurosurgery program. And with a really great partnership with Hamilton Health Sciences, where I would say making extremely good progress with both Ontario Health and the Ministry of Health on bringing that program back here. And that's an example of one of the services that we see returning here, and for sure in the new facility, if not a little bit before, to start that service, or getting that service back by then. We're also having discussions, between the hospitals, even in our planning, through our discussions with Cambridge Memorial and looking at our forecast for needs in the region. We came to the conclusion that there was an opportunity to actually build more capacity into this new facility to build on some of those needs that may not have been captured in Cambridge Memorial's functional programming, so that the residents of this region writ large are getting the care they need in the region.
Yeah, I was just, the one thing I was going to add, and it's been said here, and Sandra talked about it, is the fact is the population growth. And the merger offers, at least with my perspective with the Ministry of Health, is that it's not two hospitals, and I would argue two small hospitals, because that's how I would say Queen's Park often sees this area. But in fact, when you think about the size of this planning for the growth, then it becomes very important, because then you can attract the attention of the Ministry of Health, you can attract the attention of the professionals, and it sends a message that this region is growing and it needs that support. And I think that's where the story changes quite a bit with the merger.
Yeah, I think about our regional programs. So between the two hospitals today, we actually serve 10% of the province's population. And so when we look at some of our regional programs in cardiac, we're looking at growing some of the services there. Right now, we're actually actively in the process of working on bringing PET scanning to this region, which almost seems like a basic these days when it comes to cancer care, but that's a service we currently don't have. And the two hospitals over the last number of years have done a lot of joint advocacy to bring diagnostic services closer to home. So MRI is the best example that I have. As recent as 2018, we had one hospital-based MRI in Kitchener-Waterloo. That's significantly underserviced. Well, now we have 3. And in the new hospital, we will continue to grow that to meet the needs of the population.
Can you ask one, then I'm
Okay, go ahead. Oh, no, not go ahead, you have to wait. All right, while we're waiting, this might be an easy one online. Well, actually, it's not easy, but what will the new hospital be called? Okay, anybody in the audience, does anybody have ideas or names that you're thinking of? All right, okay.
What will the new hospital be called? No, that will not be it. It will be, our new hospital will be named by you at the end of the day. It's the community that's going to provide the input and be the ultimate decision maker when it comes to the name. And so your input is incredibly, incredibly important. I know when we announced the merger and gave our individual staffs a heads up on what was going on, that was probably one of the biggest questions we got was, can we be part of this process? Can we be part of the naming? And absolutely. So there will be a process where your input will be sought, our staff, our nurses, everybody, our volunteers, and we'll take all that information. I expect there's going to be a ton of it. And I think the biggest challenge we're going to have is narrowing it down and in the process to come to that final name. But it's going to be, to summarize, it's going to be whatever you want it to be.
And when you think about a name, the personal nature of it and the fact that you will have input into that, it's actually quite special for the region itself. So thank you. All right, do you have another question?
Sorry, is there any element of the plan to try and attract more talent, primary care and others to the region? And with that being a big shortage, you're planning on expanding. That's got to be a significant hurdle to overcome. Even thinking of people to run imaging right now is a major obstacle in the community. So is there any incentives or anything that you folks are looking at there? Thank you.
Yeah, so building a new building alone actually does attract new talents. But we can't wait 10 years for a new building to open up to start attracting. We have shortages today in our healthcare professionals. We need people today in our hospitals, medical imaging professionals, nurses, and others, as you mentioned. So we have work underway every day about that recruitment. One of the pieces that we face right now, though, is we're also in competition with each other around that, and that gets in our way. Our medical imaging service is one of the services that is together. But this is an opportunity for us to come together and actually offer better career opportunities for folks. We can work across a greater variety of settings. We can be a single employer that really actually gives lots of career opportunity and better teaching opportunities as well. Today, both hospitals are very involved in education due to healthcare professionals. This gives us even more critical mass. As an example, Grand River for the past couple of years has been a clinical teaching unit that brings on new nurses, health professionals, and physicians to increase their teaching capacity. We teach every day at St. Mary's as well, but in July we're expanding that teaching unit to be across both sites to provide even more spots for medical learners, to attract more physicians into the community, and many other professionals. So this is work we have every day. But I can tell you, as you open a new site, it's a breath of fresh air for professionals who want to come in. If you come to our sites now, we're really proud. St. Mary's turns 100 years old. A few parts of Freeport are over 100. KW as well. They're great places to work. And yet when we have brand new facilities, new space, better patient experience, it also attracts new professionals. And that's something we're excited to build momentum towards.
Yeah, and just so you don't have the misconception that we're waiting for the new hospital, and as Mark said, we work on this and our teams work on this every single day. And we do that in partnerships as well. So there's a number of programs that are funded, supported by the Ministry of Health. Both of our organizations are leveraging those today. Our two organizations, along with the Chamber of Commerce, are now looking at how do we actually leverage the talent that we have at those two organizations to pool our efforts around physician recruitment to this area, so both primary care and specialists. Both of our hospitals are actively involved in the leadership role in our KW4 Ontario Health Team, which is right now forming a primary care network to help with reducing the burden on primary care, but also make it more attractive to come and work here, including different tools like a AI enabled scribe, and we've already had really positive feedback on how that's helping. And that's the last partnership I'll speak to is, we are a hotbed for innovation and for engineering advancement through the University of Waterloo. Our two hospitals are actually forming and have formed a partnership with them to bring that innovation to our delivery of care every day and to reduce the burden so that they can do what they've been trained to do through hands-on care, as opposed to having to do charting, having to do administrivia, etc. So that's what you can expect from this new organization.
I got another question that came in. Again, we talked about hard questions. So I'm gonna put this one to the panel. Hospitals originally said the two organizations would merge. What changed?
That one's one that Tim and I love to answer. It is true. We said, and even in January when we were here, that our plan was to continue to work together, be operating the three sites together. The more we heard from our patients, the more we heard from our staff, the more we talked as boards, it became evident that we really did need to come together now. And as I mentioned earlier, the question became not why, but why not? And so that really pushed us to say, let's grow with the partnerships that we've already had in the past. And we truly believe that for us to bring what we need to bring to this community, being one organization is the best direction for us to go.
Thanks, Sandra. And absolutely, that's exactly what happened. And As many of you know, St. Mary's is a division of St. Joe's. And it was also the leadership of St. Joe's that they were instrumental in helping us get to this. They saw and heard what this community needed, what this community wanted, and it really was, why not now? I mean, that's really where the question changed. And in the context of the redevelopment project, in the context of where our community is headed from a population perspective, from a diversity perspective, it became, why not now? Like, this makes complete and utter sense and will help set the foundation for the partnership that we've developed, but really set the foundation for the ship and the health needs of this community for decades and generations to come.
Thank you. Go ahead.
Thank you very much. Thank you, first of all, thank you for being so transparent about the process and about the work that you're doing. I really appreciate it, and you're coming out, to talk to the public. So thanks very much for that. And so a couple of questions I have. One of them is, someone had asked about how much, about where's the money gonna come from, but I was wondering if you could share what you think the actual dollar figures might be. That's one question. The other question I had when you were talking about, addressing some of the additional needs that we have in this community as we grow and as we change. But one of the services that I see is we currently don't have in our community are pediatric service. A lot of pediatric services for kids, particularly with significant, medically fragile kids that are technologically dependent. Some of the kids like that, and some orthopedic surgeries and things like that. So I'm wondering, is there going to be room for, trying to address that type of population because right now they have to go to other centers for care? And then my other question is just more broadly, is how, we know that healthcare outcomes, the best thing to do is try to avoid having to go to a hospital, as great as this care is, that when we do have to go there. But so how are you working or envisioning working with the community on wellness and sort of illness prevention and that? So hopefully
I wrote it down. Let's start with the money question.
Yes.
Who wants to tackle that one? Any dollar figures?
Right back to me. So, at this point in the planning process, it would be premature to be putting a number out there for sure. It will be a large number. Over the, if you think about the size of this facility, it will be one of the larger hospitals in the province. And that's what this region needs. And it will have a sizable price tag that comes with that. Now, the local share is not the entire share, but it will need the community to rally for sure. Donors, whatever other mechanisms are available, to be able to bring that over the line. So stay tuned would be the best answer to that question. And over the course of the next, I would say, year, 18 months, we'll be doing more and more around the development of that local share. So there'll be more clarity around it. On pediatrics, and I can share with everyone that on a regular basis, we go through a clinical services planning process. And we just recently did that, and we looked at what are the needs of the community today, and started to forecast out over the next 5-10 years, what are the needs of the community going to be, and making sure that if there is a need, there's actually going to be enough volume and enough service requirement that we can do that in a high quality way. Because it's one thing to bring a service here, but if you can only deliver that service on an ad hoc basis, there isn't quality there. So that's the equation that we're always working our way through. And when it comes to pediatrics, we were actively involved with Scotland's Yard and raising money for pediatric care closer to home. We will continue to do that. And where we're able to deliver services in a high quality way close to home, we will be advocating for that, just like we're doing for neurosurgery, just like we've done for retina care. I think there's lots of examples where we know we can do that in a quality way, we're there.
maybe to build on that, the last question is about how we work in the community, because you're right, we actually don't want people to come to hospitals. Ideally, we all actually want to do well and move upstream. So there are a few ways we're doing that. One is we are actively working with our Ontario Health Team, which is all of our community support service partners, our primary care partners, and others, to look at how do we keep planning for service in our community to move upstream and keep us well. One of the efforts that we recently launched in a partnership between St. Mary's and Manulife as a major insurer, employer, and contributor in town, is we call it Prevent Clinic. It's upstream helping folks without primary care supports to get better cardiovascular care before they have a heart attack, before they have to come to the hospital, and really move upstream to keep people well. So we're going to keep looking at programs like that as a new organization. And as we think about the future of the St. Mary's sites, all of the master plan, our current design around a new hospital is exactly that. It's about building a new hospital, but we have so many other needs. So as we think about the future of the St. Mary's site, we're starting to turn our early attention to what's the future of supportive housing needs in our community? What's the future of long-term care, primary care, I heard is an important element. What are the other elements that our community need to support? How can we use that site to move upstream and provide more supportive and preventative services? That's all part of the work we need to do. That's early days, we have to start that planning work, and it'll be with that lens, we're trying to think not only what are the acute care needs, but really what are the broader upstream community wellness needs.
Now that Ron's answered the question how much this is going to cost, there's a message that I think we have to get across to the community, but also to our colleagues in the government, is that affordability is not only a question for the community, it's also a question for the government. There was the mention of 50 major projects we're going for. So one of the things that we've done is we've come up with a plan to make the project affordable for both the government and ourselves, and looking at what we're building, how we're building it, and how we're providing services over the next 10 years well into the future. And I think that's a big message that we want to carry. And that's something that was said earlier, how do we compete? Well, we've heard the government, we've addressed it through affordability, and that has a double effect, both for ourselves and for the government. So that's a big message that other communities aren't carrying, because when Ron said we're going to be one of the biggest hospitals in Ontario, yes, we are, but we have an affordable approach to actually achieving that, so that at the end of the day, we have that community hospital we all need.
Before we let Cliff off the hook, because he actually has a great answer to the last question, right? And the whole community well-being approach we're taking to our vision of future cities.
Yeah, that's one thing, and not to get too deep in the details, but when we're engaging with the community now, we're using a tool called the Community Wellbeing Framework, which actually looks at multiple aspects. It looks at social determinants of health, but it actually looks at the environment that we're creating for the hospital. And we're seeking input from the community about what does that look like? How do we, attract? What's the economic benefits of a hospital? What also are the benefits from a community well-being? And as we reach out this summer, we really want to hear from you, because this has an impact. As we move forward, particularly with the region and with the municipalities, we're also looking at creating a wellness for the whole community. The new hospital, as well as the hospitals that we're going to continue to run, are part of that community. And how do we create that well-being, not only inside the hospital, but outside the hospital as well for our community?
Who here has never heard of the Community Seeking Wellbeing Framework? Okay. So on the regional site, and I believe on the hospital site, did you speak to it?
We just had it.
Yeah. So that framework is actually the glue that will hold community together. Near and dear to my heart, because in policing, we follow the exact same framework. So what we're looking is at these public sector organizations, public sector systems to adhere to the same framework so we can all be working together. So really encouraging to hear that synergy. Wonderful. All right, so we have a question over here. Okay.
So not too many years ago, UOW expressed some interest in being part of the St. Mary's master plan. And now that we're going ahead and we have this merger plan, I'm just curious to know, has UOW continued to express interest in being part of this new hospital system? Because they're trying to get into University Health and compete with London and the other ones.
As I said earlier, we continue to have a growing partnership with UW. Right now, it's going to be around Care Next, which is what we have around innovation. And we continue to have discussions with UW. Some of those discussions aren't for public consumption at this point in time, but I would say stay tuned and you'll hear more.
I wanted to acknowledge the good job you're doing here tonight and all the things you do for community engagement. And on behalf of people, and someone else said this earlier, thank you very much. We really appreciate the feedback sessions and the opportunity to hear what's new in the world. But I'm also going to be brave and ask another money question. Maybe Cliff, the hospital budget for construction is a big number. The 10% is a big number, and that's the local share. Where in that number, or is there another number that's going to be developed for IT and equipment? Is that separate, or is that all in previous? Thank you.
Yeah, so Ron's already mentioned that 90% of the construction budget is financed or funded by the provincial government, 10% is. Right now, we're looking at working with the government to start to fund some of the IT, especially throughout the infrastructure. So we're working with them on that. Equipment is community funded. Or if it's associated with mental health, then it is 100% funded. So it's complicated in terms of the overall percentage from that point of view, but I will make a strong argument that we're setting some precedents to ensure that it's funded fully to its biggest capacity. So I'll probably have more to say about that as we get into the numbers.
Maybe not to give a number, but to make a plug. So as you asked about equipment, and I think we'll talk a bit about that. The equipment we need today is much the same as the equipment we're going to need tomorrow. Technology is always changing, but the work of our foundations, I think, we really want to recognize and appreciate, because we're out there today because we are still delivering care in our current facilities for the next decade. The new MRIs that we just opened up this year and last year, the CTs being named next, the new cardiac suites, the new neurosurgery program, these are all programs that ultimately are a partnership between our local communities, the hospitals, and the ministry. And so you're going to continue to see that request for support through our foundations to help us not only cope, but start to thrive. We don't want to wait 10 years for a new neurosurgery program, a new PET scan. We don't want to wait 10 years for the next cardiac innovation. But the investments we make now do carry us into the new building as well. Much of that that we invest in now will still be good and will just get moved. So it's going to be important to continue the dialogue together in terms of what that community support looks like.
Thank you. That was part of my question, so maybe the answer has already been given. But I think that it would be helpful for the hospitals to present information to the public as to how things are going to happen in the next 10 years, because, as you just said, the foundations will continue to be asking for money for things that are currently in the pipe. But just the last point that you made, Mark, in terms of it can be moved, that sort of thing. But I think that already individual conversations that have come to me would be, well, what is going to happen with the hospitals? That's an easy answer to give. But it isn't so easy to say how it's going to fit in with the funding 2034 as far as the equipment is concerned. So I think that some thought has to be given how we explain that to the public, so the start to fall off in years 8, 9, and so on, or maybe even earlier. So I would encourage, and if you have some answers to that now, that would be even better.
I think it's a great suggestion. We do have some of the answers, but we don't have all the answers. The suggestion of what does it look like, what's the journey look like, is one that I know our communication teams and our foundations will take to heart and make sure that we can both respond and get input from the community around
I understand, the hospital system, is managed through a board, and then there's also, so we've got, two foundations. Are the foundations going to merge as well?
I can simply say that the foundations are starting to have that conversation, but that's a conversation, I think in fairness to our foundations, they're so committed and dedicated to the work of the two hospitals today, that I think they've probably appropriately waited for us to figure ourselves out first. And so as the hospitals and the boards decide to move ahead with the merger, that will be a conversation then for the foundation boards to think about as well. And will that make sense for the community as well, and where we go next? So that's, I would say, coming for discussion here.
Okay, two more.
So the question is with the current waiting time at the hospital, like for example, Grand River or anywhere we go and the waiting time is like scary, 7-8 hours, and sometimes we 24 hours at times as well. And it is so scary that I have in my couple of years I'm scared to go to the hospital. So I'm sure you guys would know that. What is the reason of the wait time? So if you would know the reason, my question is why is not that applied to the hospital currently, which are actually there? So if the reason is lack of doctors, and shouldn't be hiring more doctors with the current facilities rather than having new hospital and new doctors where we are not able to treat the people at the current facility itself.
So I would say wait times are a challenge at both our hospitals, and we know that. And when you come to the emergency departments, folks are at their sickest, at their most fearful when they come, and you don't want to be waiting 4 hours or 2 hours or even 1 hour. We know waits can be long. It is about the sheer growth in our community. It is also about, you're right, we need to keep going out, attracting more funding, hiring more clinicians to make sure we're actually delivering care for our community. Our community, the growth rates, we say we're going to be 1 million ready. It doesn't wait 10 years and then we're all 7 million. It's growing every single day. And so our emergency departments today are seeing 20% more patients every day than they were even 3 years ago. And so we are seeing significant growth. It's something that we're actively working on responding to. But you're right, we can't wait for the new hospital.
Yeah, I would echo that, and I'd start my comments by saying I'm saddened to hear that you're scared to go to the hospital. We always strive to be a safe place, a welcoming place, and if it is about Grand River, I'm sure Mark would echo this, I would ask you to maybe find me afterwards, and I can connect you with our patient relations people and make sure that we hear your voice and it helps to inform positive change at our organizations. As Mark was saying, we are cognizant of our wait times. Our teams work on it on a regular basis. One of the things that probably isn't typically widely known, because I heard your comment of hire more doctors. Typically, doctors actually aren't hired by hospitals. They are independent people who have privileges to practice in a hospital. So they are paid directly by the government. And that doesn't mean that we don't do a lot to try and recruit the people to our community, because it's a great community and we need people like that. And then the last thing I would say around it is, there is a reality that there's a flow that happens through hospitals. And typically when emergency rooms get congested, it's because we no longer have inpatient beds to move people who have been admitted into an inpatient bed. The hospitals, including Cambridge Memorial, including other hospitals in Waterloo-Wellington, over the last 4 years, have advocated together, and we've actually grown our bed capacity by well over 200 beds. But we still have the challenges because of the growth. And we continue to advocate for those upstream investments that Mark was talking about earlier to allow people to stay home longer or allow them to get home faster. And both of our hospitals are actually investing in those types of programs right now. So we're not waiting for the new facility.
All right. Thank you. Our last question.
Hi, my question relates to the operating culture of a new merged organization, because St. Mary's and Grand River feel very different when you enter them. In the emergency room, you get treated differently.
There's a different level of attentiveness, and that's not because of the frontline staff, because I think the frontline staff of both organizations are fantastic, but there's a difference in operating culture, and I also know from people that have worked at both organizations that it's very different. So in a new merged organization, which model are you going to kind of lean towards?
So it's a great question. We do have two different great cultures at the two hospitals. And to your point, we actually have many of our team members who work across both hospitals. And so they actually are our best agents of this integration of cultures. Our intention is to bring the best of both. We have great cultures in both places. We deliver great compassionate care in both hospitals. The secret sauce for this merger is going to be to find out what makes the difference in the culture, what is the best of each color, and how do we bring those together. And so that's the work we do. We have, I can tell you, if I think about St. Mary's, we have over 100 nurses at St. Mary's who also work at Grand River. Those folks know exactly what those culture differences are and how we help bring them together. I know there's even more than that. Grand River folks who work at St. Mary's. So through the partnerships we've had over the years, not only from our frontline teams, from our leaders, the work we have now in front of us, the opportunity is to figure out what's the best of both and how we build a culture that actually integrates both. It's also not overnight. Culture, for any of you who kind of work on culture, it can take years, but it's one of the reasons we want to have a really early start to this coming together in a partnership. So by the time we open a new hospital or the new building, we are in one great, really vibrant culture that serves our patients and our communities in the way they need to be served.
Yeah, the other thing I'd add, we talked a little bit tonight about the facility and the new facility and the positive impact it will have. But I think it's not lost on any of us who lead in hospitals or any of us who use hospital services. The facility is not the hospital. It is the people and the culture that lives in those walls that are the hospital. And that's something that both organizations are really seized on, and why we want to build from the best of both and augment that front with maybe new ideas as well.
Wonderful. Thank you very much. This brings the panel to close, but I'm going to ask the panel to give the audience a round of applause. Thank you. Judging by the questions, to see that community is so invested in this, and taking it to, it's a personal endeavor for you and for your loved ones, for your children, grandchildren. This is a legacy that's going to be left in Waterloo region. So thank you again. So I want to again thank all of you, the audience, for coming out and engaging in this discussion and providing your insights and ideas and really, really thoughtful questions. To our panelists, thank you for bringing us along the journey and for helping the communities better understand where the hospitals are at in both joining together and building together. So if you haven't already yet done so, please fill out the survey. And if you didn't have a chance to ask your question or one comes to you later, please visit futureofcaretogether.ca to learn more and provide feedback. With that, thank you all. Safe travels home and good night. Thank you for coming.